you go. So you use sac 302, so you want to make sure it's a 302, which it is. 302. And then don't unfold it. So then you're gonna turn it this direction, and it's gonna go just like this in the back of the tub, all the way in the back center. So you can pull this out, and then you're gonna push that all the way to the back center. It's all the way to the back. Now you can flip that bottom part out, and then that'll expose all the tubing. That little foam piece you can pull out, throw it away. You don't have to worry about that piece. Just let it lay there. It'll, when it fills, it will work itself out. So you're gonna pull the little paper tab off of there. And then this little plastic piece right here holds these two, because this could come apart, so it just holds them together. So you can just make sure that this is twisted on tight, and then just rip that off, the little plastic piece. It'll just come right off. Alright. So next, it's asking you if you want to make a batch. Just hit green for go. And we're going to follow the steps. It says load the sac. We already did that part. So hit the green button. Oh, open door. I'm sorry. Open the door, load the sac. So you should be able to open this. And then we're going to put the lines in there. So you want to put it, grab it like this, because this is how it's going to go through here. So hold that. You can let the other part go. So there's only one way it'll go in here. This blue side needs to be over here so it can match with the blue side. So this little T goes just like this. And then this pops into here.
Okay.
And then this goes into here. Exactly. And then that tubing, you just feed that through there. Nope, right here. And then go ahead and close that, and it's going to feel tight. You have to just push it down. Okay? So then you can leave this hanging over here, because that's good. Now, when you close this door, you want to make sure that all of these are in their little hanging areas. So when you close it, you just want to be careful of that, because you don't want to pinch the tubing. So you should be able to, you can tell if you do this, if the line is pinched or not, because there's enough room to move it. All right, now you're going to connect the lines. So you can go ahead and connect the orange line. So grab that one, and there's a little cap on the end. You just take that off, and it's going to go right here where the orange is. Hold the fat part here. There you go. And then just finger tight, not super tight. And then the blue. So if you'll notice, the blue, you're going to take off this piece right here, because you see it's right here. And you don't want to touch the tips because it should be sterile. So you can take this little leg off here, and then you just pop this and it screws it under there. can go in the garbage. Just flip that up. It's a little cap. And then that just screws together. Just finger tight. And then, so right here, you're gonna take one of these and just pull it till this pops up and straightens out. Pull it. And then you can pull off that little piece of plastic. Throw that in the garbage and then slide that down to cover the whole crimp. Slide it all the way down as far as it'll go. You can leave the little tiny piece. Same with that one. Just make sure you don't lose these pieces in here. I don't know if it'll set off the sensors. So you just want to make sure that that's all the way down. Okay. So the next thing to do is before you hit the green button, because you've already connected the lines, is to make sure that all the clamps are open. So these three should be open. So that one is not. So you need to open that one. They should all three be open. The orange should be open. And they are. So then you can go ahead and hit the green button for go. And now it's starting to make a batch. Get your cartridge. Get your bag of saline. Open the door, reach behind, turn on the switch. You probably can't see it from there. It is on the left-hand side of the machine as you're facing the machine. Always double check your expiration date. August of 2020, we're fine. Open your cartridge. Remove your paper. Find your priming spike and tighten all your connections. Just make sure they're tight, because they're almost always loose. Once you have your goalposts, yellow flashing goalposts, you can take your cartridge, insert it in your dialysis cycler. You have 3 posts, 1, 2, and 3 that have to be in place. Once those are in place, make sure everything's clear, especially that line that is not in here. Close your door, push it down till it clicks. At this point in time, you can take your pressure pod, you can hook it to the pressure port and tighten the threads. We're going to work out some SpaghettiOs. Okay, you want to prime your bag of saline, pull the blue port off, pull the cap off. Do not touch that part. I like to go overhand, insert this into the bag of the saline with a twisting motion till you're within 1/4 of an inch. You'll physically see the spike in the bag. Double check that the bag has not been punctured. It hasn't. Once we've done that, press the green button that looks like a water cup with a faucet. It is now going to fill the bags and take all the air out of the system. Machine is priming. We can save time and we can gather our supplies. We need a pad, and this is for the clinic. At home, some people don't use pads. We need 2 needles, 14 gauge biohole needle. That means that these are blunt needles for use with a buttonhole.
We will need 2 alcohol pads. We will need 2 betadine prep pads. And we will end up using a grand total of 3 syringes. We get our heparin. We know our heparin dose is 3,500. We always alcohol wipe the top of this bottle, even when it's brand new, opened for the first time, because we don't know that it's sterile. Open our syringe. It's just easy to peel the paper back. Draw up on the syringe the amount of air that you're going to put in and draw heparin. So in this case, it's 3,500. That puts the bottom of our plunger just at the 4. Carefully remove your needle. Invert your heparin. I like to use a bridge on my hand so I don't stick myself. Inject the air and draw back your heparin. If you have bubbles, you can thump the syringe a little bit and work the bubbles out. They're not really critical because we're going to draw blood into this. When we've got this, we draw this back to 35 and lift straight away, being careful not to touch the needle. We want to recap this needle. This is something that also you have to be very careful so you don't stick yourself. I put my fingers on my hand to give myself a bridge, and I very carefully place the needle back in place. I want to mark the syringe so I do not mistake it for saline. So I put a piece of tape around the syringe. This way I know it is my heparin. I now set this over with my supplies that I'm going to use. We're also going to need a roll of tape. And to begin with, we're going to need 2 pieces, approximately 4 to 5 inches long, split roughly down the middle if you're talented enough to tear it right down the middle. These are going to anchor our needles. That is for the arterial needle. This will be for the venous needle. We're also going to need 2 pieces of tape, approximately 6 inches long, to anchor our covers that cover up the access site while the dialysis is taking place. We can take our 2 syringes that we're going to use for saline and we can set them over by our machine so we know we're ready. Today we're going to draw labs. So we'll go ahead and we'll get the supplies ready for that as well. Always double check the expiration dates on your tube. These are 2020, that's fine. 8/31 of 2019, that one's fine. And 2020, that's fine. Draw on your labs. Put your tube right here. Your tube goes here on the machine. I tape it there. This is the personal thing because this way I remember to draw my post-BUN tube at the end of treatment. Otherwise, we can't calculate your adequacy testing. So the tubes that you will most likely draw every month are an orange top, yellow top, whatever you want to call it, gold top, and 2 lavender tubes, and then a green top. The order of draw is very important. You draw this tube first, then you draw these 2, the lavenders, and then that one is done at the end of treatment. The tubes fit in this. You'll have those at home. These just thread onto your needles, and then the tubes slide into here, and the blood flows in. So right now, we'll put this over here to make sure that I know, and we will put the tubes over here that we're going to use. That way we do not forget to draw labs today. Labs are drawn once a month at least. If we have a problem with something, it may be more than once, but for most of our home hemo patients, it's once a month. I like to make sure I have my chicken foot up and ready. You see this, it's already been used, the clamp is already closed. We still have 2 ports that we can use. We want to make sure that these caps stay on at all times to guarantee sterility of the line. Again, I bump my dialyzer. More air bubbles come out. We want to get the air out of this dialyzer now. As we do that, it just saves time later during our snap and tap process. We can actually speed this up by looking at the lines now and inspecting them for air bubbles. Sometimes the air bubbles are very small and difficult to see. When in doubt, you can use a tapping stick and just tap your lines. Notice I'm not hitting my hand. I'm just gently thumping the lines to break any air bubbles loose. It's looking pretty good. Hang my line back up. That way it's out of my way and accessible for when I really need it. The yellow button tells the machine to be quiet. Your screen is reading off 1, 2, 3, 4, A, B, C, D, E, F, G, H. Goes through the numbers to make sure that all the segments are fine. Once that happens, tell it to be quiet again. You're going to see 23 on the dial. Once you see 23, that is the time that we do our final testing. And make sure that we have no air in our system. Looks good. Got the air out of the lines. We want to remove our dialyzer. Now thump our dialyzer a couple times. Turn the header up this direction so the air bubbles can get out, and we also want to bleed the dialyzer. The blue line goes to the top. This is best done over a trash can. Loosen this up and allow water to bleed out. Once it's bled out, close the cap gently. Close your clamp. Again, I just want to make sure all the air bubbles are out and it looks fine. When you're done taking your air bubbles out, put your dialyzer back in with this line to the top, these lines to the bottom. We're going to do a final inspection of our lines. All the air has to be out of the system. If you see air, you can do what we call a snap. Or as I've shown you, you can take your stick and you can do a tap. Once we're sure that all of the air is out of the system, we press stop, the red stop sign. We validate and make sure that the default settings are here. Our default blood flow rate is 200. Our default removal rate is 0.9. Now we're going to enter our treatment data. We've determined that today we want to take off 1.5 kilos. We press the thing that looks like a measuring cup. That says volume. We will use this arrow, the up arrow, to increase this to 1.5. If you go over, it's okay. You can always use the down arrow and go back. Don't touch the green buttons right now. This will automatically go back to the rate screen, or you can manually change it back. Now it's time we do some math. We know our treatment runs approximately 3 hours. So we want to take 1.5, which is the amount of fluid we want to remove, divided by 3, which gives us a rate of 0.5. So we're going to increase that a little bit because it helps our treatments run the correct time. So this, we're going to use the up arrow, and we're going to increase to 0.7. And again, it's okay if we go over a little bit. We can always take that arrow and go back. 0.7. At this point in time, we want to maximize our filtration fraction. You push this until it won't go. Notice the light goes out. The only way that we can go is down. So our default would be 4.1. Okay? Once we've got our treatments data in, we want to start priming our lines. First step, you want to prime your saline T. Loosen the cap a little bit, get the air out, gently close it, close this, and all your clamps. White clamp, green clamp. These clamps right now don't matter. Slide this up so you have room to work. Close. Yellow clamp, close. Red, close. Big red, close. Big blue close, yellow close. Now we're going to take and we're going to get our saline line, and we're going to connect our saline line to our treatment line. So we get our saline T in one hand. We cannot let go of this line when we make the connection. So I like to have these both in one hand like this. This way I can take my saline T off, take this, and connect it. You'll notice white and white go together. Drop that line to get it out of your way. Pick up your chicken foot. Ideally, we can fix SpaghettiOs later. We find a clamp that's still on, and notice I'm not touching anything with this. The end is completely clean. Take that cap off, throw it on the ground, thread those together, unclamp this green clamp, and press go on our PUREFLOW unit. Red is stop, green is go. Now it's getting the air out of the dialysate system. Next, we want to find our coupler. When you take it off the line, the best way is to pinch it like this, because if you don't, you can flip that cap up. We don't want to touch the ends, they're sterile. Flip the cap up, get our coupler in our hand. We're going to set that aside for right now. Next, we're going to do our P line. This is not a sterile connection. Disconnect it, leave that dangling, and take this. Notice how the lines are all messed up? We can even let that line go and feed it through and get it away from all these other lines to get rid of some of our mess. And this hooks up to your waistline extension on the PUREFLOW. Open both yellow clamps. I like to slide the clamp and move it a little bit. That way it makes sure that there's no kinks in the line. Okay? So we're going to go back to our coupler. Our coupler is still capped. We're going to get our blue line. We're going to very carefully disconnect our blue line, open this, and connect that very carefully. At this point in time, we keep this line in our hand. We don't want to drop it. We want to connect these two to protect the sterility of our saline bag. Okay? Next, we've got an open end here. It's capped, but it doesn't have anything hooked. So we're going to take our red line. Very carefully, we remove our red line, we take our cap, we drop it on the floor, and we connect our two together. Now we have nice sterile lines that are protected, and these are ready to use in dialysis. Now's the time. If you have SpaghettiOs, we'll get those cleared up in just a second. But these lines we're going to set aside. Now's when we need to get our saline ready for treatment. Again, it peels through the back the easiest. Take our needle off. Notice I keep my needle in my hand. I'm not touching it to anything because we need to maintain sterility. Connect, open the clamp, draw up 10 cc's of saline. It doesn't have to be exactly 10, and you don't have to have all the air bubbles out. Close the clamp. Very carefully put the needle back on. Take our next syringe, open it. We're going to take the needle off. I like to hold it, but it doesn't matter on this needle. And again, we're going to carefully connect it to this. We're going to draw up 10 cc's of saline that we will use at the end of treatment. We close our clamp and we leave that one hang. This is now ready to use in our treatment. We will set it here, and the old needle always goes in a sharps container. Okay? So now that we have that done, we can straighten out some of our SpaghettiOs because all of our lines are protected. Our saline line right now is running under our treatment line. The important part is we maintain our bag in an upright position. We don't want to have that down because we do not want that to get air in the system because we've worked so hard to get air out of the system. So now we have lines that are nice and straight. We're not going to have any issues with shortness, patient being discomfort. All those are set aside and ready for use. So we want to remove the emla cream gently, but completely. At this point in time, we're going to take a look at this fistula. It looks very nice. We've got some pseudoaneurysms here from past use, but they're actually decreasing as we use these new needles. First thing we're going to do is we're going to alcohol wipe. I'm going to use one alcohol wipe on this access, which is his arterial. We go in a circular motion. And this is the venous site. And again, we go in a circular motion, making sure that we've got everything covered with alcohol. We now want to let that alcohol dry. After our alcohol is dry, which takes approximately 15 to 30 seconds, we want to use betadine because betadine really works great for antiseptic. And again, we want to coat this whole area because we want to make sure there are no bacteria growing when we put needles through that fistula. We use a new betadine pad for each site. Again, the arterial and our venous site. We now want to let this dry so we have optimum efficiency. Our betadine is dried sufficiently. We want to take a pick. We want to make sure there are no scabs present in his buttonholes. Very gently use the pick. And open that hole up just a little bit. Once you do that, use the tip to just make sure that there's an opening. These should be put in a sharps container because they are very sharp. We use a new pick for each site. Luckily, with the use of the EMLA cream, it has pretty much eliminated scabs. Okay, we are now ready for cannulation. Carefully remove your cap. The bevel of the needle, you'll see the needle is beveled, and the bevel goes up. You can pinch it by the butterflies, apply some traction, and the needle goes straight in. If you have problems, withdraw it, just slightly, but never fully remove the needle. When you find the correct angle, the needle will slide in very nicely. Sometimes we twirl a little bit, and it helps the needle find its way. Once the needle penetrates, you'll feel it pop. You want to secure that immediately with a piece of tape. And create a chevron underneath it to make sure that that needle doesn't come out. We'll move on to our arterial site. Our venous site. This one goes in at a slight angle and slides in like butter. Although our patient may not feel that that's the most comfortable butter in the world. And again, anchor these down to make sure that they don't move. Now I want to bleed both of our lines. Get the air out, so you'll loosen the cap just slightly. Let the blow flood to the end and close. We'll now close our clamp. We'll do this on both lines. We're going to draw labs today. So while the clamp is closed, we remove the cap, we put on the adapter, we draw our tubes, our yellow first, gold, whatever color you want to call it, then our lavenders. We close our clamp, we remove our adapter, we take our syringe which has our heparin in it, we open our clamp, withdraw, pop the tourniquet, and we flush this in and out to heparinize our body. And then when we go, we stop just shy of the bottom because we don't want to put any air into the system. Now it's time to start making our connections to our lines. I like to have things in line. So we disconnect, we pinch up just slightly to make sure there's no air in the system. And we release our clamps. Same thing with our venous side. Make sure the clamp is closed. Take your syringe off and drop it. Without touching anything, squeeze a little bit, make our connections, and open our clamps. Once we've made our connections, we move over to our dialysis machine and we press the green kidney button. This begins our therapy. If you get a beeping alarm, double check. If that light is still on, press that button again. We notice the lines now are filling with blood as the machine draws the blood from the body into the dialysis machine. You always want to invert your tubes gently, 7 to 10 times. You don't want to shake them. Shaking them actually damages the blood cells. So gently invert them, making sure that you surround the blood completely in the tube. Then we can set those aside. And we can do some cleanup. Sharps must go in a sharps container. During the clinic, anything with blood needs to go in the sharps container. We're not going to cover up the access at this point in time because we're going to verify that our pressures are okay. So we're going to watch our dialysis machine. Our arterial pressure is 0. Our flow fraction is 40. Our venous pressure is 125. We want to take a blood pressure right now, and those readings need to be recorded. Get our flow sheet. Time on the machine is 9:20. Our effluent pressure is 135. It asks our access. Our access looks fine. Our arterial pressure is 0. Our venous pressure is 137. If we go, we are now in our rate screen. The rate on the green is 4.1 and the rate on the yellow is 0.7. We switch over to our volume. The volume on our green is 29.9 and the volume on our yellow is 1.5. We know our pressures are okay, so we're going to take this up to 300. We're going to monitor our pressures. We do not want high arterial or venous pressures. We can also maximize our filtration fraction, as that will help keep our treatment on time. Again, we use this till the light goes out. Check our blood pressure, 27/75 with a pulse of 94, which is fantastic. Our venous pressure is 230, effluent's fine. We know our arterial with this patient is no problem. So we're going to take our blood flow rate up to 400. And again, if you go over, just go back slightly. Again, we're going to maximize our filtration fraction. I hold the button till I can't and then nothing changes. Notice our FF is 40. We always want to see that as it flashes across. Our venous pressure is 280. Effluent pressure is 270. Arterial pressure is 72. No issues. We're going to go to 450. Our venous pressures are just under 300, which is what we want, which means that we could manipulate the needles just slightly. This is why I have not changed the position of those needles, or I have not covered them up. Our arterial pressure is fine. So I want to watch my machine, and we're going to modify our venous needle. Lots of things we can do with our venous needle to try to improve our pressures. So we can go ahead and cover up our arterial site, half a 2x2. You can do that or fold it in half, one of the two, it's personal choice. And just cover this site up for protection so we keep germs off of it. Now we're going to do a little modification to our venous site, because we think we could just improve our pressure a little bit. We could move our needle a little bit side to side. You just want to be very careful that you do not dislodge the needle, because that becomes an emergency. So we're going to move this needle just slightly to the side. That dropped our venous all the way down to 260, 270, so we made a big improvement there. So we're going to tape it down for now, and we're going to take our blood flow up to 470. Let's go 480, see what happens. We're watching our pressures again. Our venous is now 300, 311. We want to keep it right at 300 or a little bit below, so we're going to drop this down to 470. Again, if we watch the screen, it'll rotate through. We will see the FF once it reaches is not 40. That means that this arrow needs to go up. If you don't maximize this, your treatment time will be extended. Let's see what we can do. We might move this needle a little more. We could try pillowing it a little bit, lifting up. What we're doing is we're just watching the pressures as they scroll through. That improved our venous pressure. So that tells us that we might be able to live. And I'm very careful not to allow this needle to dislodge right now. It tells us that we might live with a small 2x2 underneath our butterflies. Some patients require this, some patients don't. Monitoring my pressures. That dropped our venous down to 270, 280. So that is an improvement. So we're again going to put our tape back on, anchor things down. Put our chevrons in place to make sure that we don't have anything popping out. And look at our pressures, because slight movements make a big difference in our pressures. Our venous pressure's down well under 300, which is what we want. So it looks as though we're going to be okay with our numbers. We will get another piece of gauze, because again, we don't want this exit site to be exposed to anything while treatment's going on. And again, it only takes a half a piece of gauze. Put it right over the top where the exit site is, and apply a piece of tape just to be protective. At this point in time, we can anchor our tubes to make sure that we're not going to have and give a strain relief so our patient is allowed some mobility. We take the tubes. They're generally placed best for most patients' comfort on the outside of the arm. And then we can tape them up to their shirt up here on their shoulder, making sure we have good contact and those tubes are locked down nicely. Put our clamps organized, and we are into treatment. So when the machine dings that you're done, press the red stop button. Take your syringe from here, clamp, clamp. Connect the syringe onto Tommy, unclamp, flush, reclamp. Take your red line, being careful not to touch anything. Connect it to the red line up here that we've now made open. Unclamp, unclamp, and press the add fluid button. You'll see 277 start counting down, and this start getting less and less red as we give you all your blood back. All of that is fine. We've got all of our supplies ready to take your needles out. And before you do this process, you always want to make sure that this bag has at least 300 cc's of saline in it. If it doesn't, you'll get air in the system and that becomes a whole new problem. So we were fine. We had almost 500 cc's of saline left. So as this is counting down, it's flushing this back, the 277 cc's of saline, to give you all of your blood back. Once we've reached zero there, we can reach down and hit stop on our PureFlow unit. I'm old, so I like to sit on the chair when I do this. We set our clamps here. We close our clamps, and we're ready to start pulling needles. I like to have 6 pieces of tape ready, all of them approximately 6 inches long. These are for taping off your access. We start with your bottom needle first. We take our chevron off. We can actually put this back up here to get it out of our way, so we don't have to worry about, I'm sorry I'm in the way of your camera, but that way we don't have to worry about getting that needle in our way. We take our second piece of tape off, and we do this very gently because we don't want the needle to become dislodged without being fully ready. This tape stuck like crazy at you today. So when it comes time to take it off the bat wings, I'm very careful not to pull your needle out because I don't have any gauze ready and it will spray blood everywhere. So we get our clean gauze. I fold it in half and I fold it into a quarter. We get our needle ready, we pull our needle and we apply pressure. And these go right into the sharps. like I save my little gauze that we're covering your deal. That way if there's any little extra blood, I can wipe them off so we don't leave a mess on your arm. And we just hold pressure for at least 2 to 3 minutes, just to make sure you're fully clotted off. We need to strip our machine, but the first thing we need to do is we need to get our data. So to get our data, we press this button. This button here looks like a cup, a measuring cup. It says that we took off 2.5 kilos, which we put right down here where it says total UF. 2.5. It says that we used 30 liters of dialysate. Total dialysate. 30. Our total time was 3 hours and 2 minutes. So right over here on this paper, it says total time 3:02. And it says we removed, we'll go back, 92 liters of blood. And that is here where it says total BVP 92. Post dialyzer, we look at your dialyzer, it is clear, there are no streaks. We circle that right there. We want to look at your arm. Any bruising, infiltration, this would be swollen and huge. There's no bruising, there's no infiltration. On our flow sheet, bruising, no. Infiltration, no. Bruit and thrill, yes, I can feel that. Bleeding time today was approximately 2 minutes, which is really minimal. Tommy, are you short of breath? No. Any swelling? No. Any digestive problems? No. So all we will do is then we will need a final blood pressure and you will be good to go. So when we're done, we've got our data. We can reach back on the left back corner of the machine. You probably can't see it from there, and turn it off. Disconnect your pressure pot. Clamp the line that you're using on the chicken foot, only the line that you're using. And you can disconnect, clamp that green line as well, disconnect your line, and save this for tomorrow. At the same time while we're here, we can disconnect our saline waste line, the yellow line. Clamp both clamps, disconnect this line, and this line, to get it out of the way, can go right back up where it was. So now all of our yellows, now we're right back to where we started. This line can actually connect to this line, which is the way that the things came out. So we're all done. Open the door, lift it up, remove the CYCLER cartridge. Comes out very smoothly. Pop the dialyzer out of place. Close the door gently till it clicks. Then all of this can roll up burrito fashion so it takes up the least amount of space in your trash can. This is a personal thing. If you choose to do it, you can. If you don't want to, you absolutely don't have to. We like it here at the clinic because it takes up the least amount of space. Here at the clinic, I'm going to drain the saline out of this, but at your home, it just goes in the trash. And that's takeoff.
Alright, we're hitting the stop button. Alright, now press and hold the stop button. So, drain complete, we're going to say done. So hit the stop button one more time. Now it's going to do this flush for
taking it out the drain.
Putting it in the drain. Alright, so now we're going to clamp all 3 blue clamps. Okay, then hit the green button. Alright, I would clamp the orange line too. Now you can open the door on that black door. There's a lever right there on the side. Pull it. There you go. And so the little pump on the right side, push the top of it up. See that lip? Push it up. And then pull out all the tubing. and then push the pump back down to close it, the one on the right. And then close the black door. And then you're going to disconnect the orange line right there. And don't let it get, dangle inside the tub. And then you're going to disconnect the blue lines where that little blue connector is in between. See the little blue connector? Right, so unscrew that, the blue part. So hold here, and then, there you go. And then pull them apart. Maybe, if it's easier, hold the clear part, and then hold that clear part, and then twist it. There you go. And then you can drop that over to the side. You don't want it to drip in the bucket. And then you can pull that bag out, and then it just goes in the garbage. Toss it in there.